Good morning and welcome back. It's about 13 minutes before 7 o'clock. ACL tears appear to be on the rise, especially among younger athletes. They can be painful and often debilitating. And here to talk about what can be done to prevent a possible tear is sports medicine physician at Gundersen Health System, Brad Fowler. Brad, thanks for waking up with us this morning.
My pleasure.
So first, could you give us the details? What exactly happens in an ACL tear?
Well, the ACL is the ligament that stops your knee from shifting. So if you were to plant and cut, your tibia would move underneath your femur bone if you don't have an ACL. And what often causes it, surprisingly, is not contact. People think, a football player got wiped out or they got hit. It's actually non-contact. It's running down the court or the field, planting your foot and twisting, and that accounts for about 70% of ACL tears.
So what sort of evidence are we seeing that these injuries are on the rise, especially among younger athletes?
Well, we just have better data. I mean, it used to be thought that it was more of a injury that happened to males. And it turned out that males are just playing more sports. Now that girls play more sports, we found it actually happens about 2 to 8 times more commonly in girls than boys. We see it happens about 150,000 times a year in the United States.
Is there a specific age group that it's affecting more these days? Is it younger athletes? Is it more college age? Or is it just kind of across the board?
Well, it's more of the younger athlete. We're actually seeing more of the young teens. It used to be more of the older teens, the 20-year-olds, and I think more for just the sports participation that we see. We're seeing now 12, 13-year-olds, where we didn't used to see that before. And
the course of treatment for this is often surgery, correct?
Usually is. For the young athlete, we usually recommend surgery. We find that without surgery, the risk of further damage to the knee is pretty high.
So with the idea that athletes, especially younger athletes, are starting to work out their muscles more, getting the idea of bigger, faster, stronger is, I believe, the term that's tossed around a lot. Is there anything you can do to train the ligaments to become stronger as well?
Not really train the ligaments, but we can train our muscles. There are actually a number of prevention programs that have been demonstrated to show that at least in girls, we're decreasing the rate of ACL tears.
And is there anywhere we can, or young athletes can find these sort of training programs?
Certainly. Gundersen Lutheran has, or should I say Gundersen Health has programs for prevention, yes.
Okay, so visit your doc as sports seasons are starting up, and if you're concerned about this especially, is a good idea to get on one of those treatment plans, right, Brad?
That'd be a great idea. Preseason is prevention can certainly help.
All right. Thank you so much for joining us this morning, Brad, and we'll head to break.